you the question, Claire. If you had a thyroid problem and you had to take thyroxine or carbimazole every day, how would you remember? How would you?
I would take it in the morning before my breakfast, and I would probably keep it beside my toothbrush or something like that. But I totally, having kids of my own, know that mornings can be absolutely manic in some households, and so what I tend to say to families is, yes, it's best to take it in the morning before you've had your breakfast, but if that's not going to happen and you can only do that 2 days out of 7, then it's much better to find a time of day that suits you and actually just consistently do that. So if you've got something in your daily routine that you always do, just keep your box of thyroxine tablets beside that, or your carbimazole or whatever, and you'll remember. And actually quite a lot of our teenagers coming into clinic now, take ownership themselves, and they've got their own dosette box in their room, and they just do it themselves, which is brilliant. And I always think, the sooner you can get, children to take control of their own illness, so they know the importance of taking it, I think they're far more likely to take it that way.
There's another question here, Claire, which is one that obviously, understandably crops up. It's the question of therapy with T3 as opposed to just T4. Do you have a particular view about that, or?
I mean, it's difficult, isn't it? Because you see so much in the papers, and you read about these things, and it's something that we just don't regularly use in our clinic, do we? I think it's hard, isn't it? Because free T4 is the driver, and levothyroxine in so many of these patients works so well. There isn't that evidence base for T3, and I know there have been some studies looking at it in combination, but I'm not convinced that the evidence is there to go to the hassle of adding in extra medications for children. I don't know, what do you think about this?
Yeah, because most of I take your point. People talk about the randomized trials in adults, as adults, not children, and how, as a general rule, they've not shown any significant benefit of adding in T3. And people have, I think, quite rightly said, well, that doesn't, just because the trials to date haven't shown a role, doesn't automatically mean that there isn't a subgroup of individuals who will benefit from T3. I guess my take in young people is, and there's a certain purity about young people, before you get bogged down with all the stuff of life, the mortgages and what have you. And the vast majority of young people I managed with just T4 seem to be fine on it. And I say that because we've got people who have won Olympic medals on just T4. So if you can win Olympic medals just on thyroid hormone replacement, it can't be that bad, I would argue. And as I say, the young people, as a rule, come back with a smile on their face. They, as a general rule, they get the same kind of issues that other young people get. Sometimes they get tired in the same way that anybody gets tired, but usually there's an explanation for it. So I think that for the vast majority of young people, T4 seems to do the job pretty well. Yeah. But is it an area that needs further study? Yes, there may be there's still some unanswered questions, and I know of new trials that are focusing on this particular issue, but primarily in the adult population.